Hello, I'm Dr. David Hornbrook with another episode of View from the Other Side of the Bench. Today I'm going to talk about the aesthetic prescription, the lab prescription. It's different than your just traditional single unit for a posterior. There's so many variables in a smile that it's really important for me as a clinician to transfer those variables to the ceramist after we've discussed them with our patient, and so our patient gets a smile that they always dreamed of. So I'm going to go over this prescription and why we put it on the prescription and the importance of it. Again, this is our cosmetic, our aesthetic prescription here at Utah Valley Dental Lab. And the first thing that we notice is type of restoration. Now, why is that important? Well, in a laboratory, especially in this day and age with modernization and also the technology we have with digital, we want to make sure that it goes to the right department in scheduling. You want this case back in a certain allotted time. We want to make sure that happens for you. So it's important to tell the lab exactly what you want. And sometimes you may have an implant with a zirconium abutment and an Emax crown and then Emax veneers, or you may have a 3 or 4 unit zirconia supported bridge or a monolithic zirconia along with some Emax or Emperors or different type of restoration. So it's really important as we fill this out that we tell the ceramist, the laboratory, exactly what materials that we want. You know, I think it's no longer acceptable to say porcelain crowns 6 through 11 or porcelain veneers. I mean, there's so many different ceramics. We should be calling that out. And if you have a question about when's the advantages of using one over the other, call and talk to the laboratory. I mean, the advantage of a laboratory, we work with 1,000 dentists. You work with 1 dentist or 2 or 3 dentists. And so the experience your laboratory can give you in helping choose a material is invaluable for long-term success, both aesthetically and functionally for your aesthetic cases. The second is items included with case. Now, we put this on the lab slip because it becomes really a packing sheet for you and your whoever packs it, whether you're a receptionist or your dental assistant, in your office. And then it becomes an unpacking sheet for us here at the dental lab. And I know all of you that are watching this have had cases where you forgot to take a stick bite, you forgot to take a bite registration, or you forgot to take an opposing, or the opposing somehow did not get put in the boxes. It was shipped to the dental laboratory. And I know that because it certainly happened in our office, but we see it in the lab all the time. We got to make a phone call. Hey, we didn't get your opposing. There it is. It's sitting on the bench in your lab in your office. So this again is a packing sheet. As I check these different boxes, whatever it is, whether it's a Facebook jig, the opposing impression, maybe a mounted model, maybe a wax up model. As I check those boxes, my dental assistant literally taking a highlighter, opposing impression. She'll highlight that and that will go in the box. If for some reason I checked stick bite and there's not a stick bite there, then we know we either left it in the operatory or maybe we forgot to take one. We have to take one before the patient leaves. And then the laboratory becomes an unpacking sheet for the reason I mentioned earlier. Maybe you forgot to put it in the box. And so as the women in our shipping department, as they go through this case and they say, oh, he checked CR bite registration, but it's not in there. That's a quick phone call to you. Hey, we didn't get that bite registration. We didn't get that mounted model. We didn't get that item that you checked in the box. You can get it to us as soon as possible, so then we can get that case moving forward, get it to you on the time that you want it so you can see that with your patient. The third item is goals for the case. Now, why is this important? I mean, that's what we discuss with our patient, right? We sit down with our patient and say, what are your goals? You want it to look natural? Do you want the whitest smile on the block? Do you want to lengthen teeth? Do you want to close diastema? I mean, what are your goals? So that's the conversation we have clinically with our patient. I want to make sure the ceramists, as they pick up that case, they're on the same page as myself and my patient. If the goal is a more youthful smile or more feminine smile, or to maximize symmetry, or to bring up the gum tissue and get better gingival symmetry, I want my ceramists, as they're designing this case, to start basically the same place I started as I talk to my patient. And it just gives them a frame of mind as they design this case. The fourth item is the prep shade. And that's important because there's 3 factors that affect the final shade of the case. One is the ceramic itself. The more opaque or the brighter the ceramic, the less influence the underlying prep plays. So that's the primary influence, the ceramic itself. The second is the prep. If we're fabricating you a veneer or a crown that's less than 1 millimeter thick and it's translucent, so it's just replacing enamel, the underlying prep, the shade of the prep, significantly affects the final shade of that restoration. So we need to know what that shade is. And thirdly, the cement. And the cement will affect shade. We can change value. We can make it a little bit brighter, a little bit warmer. It's not going to have as much influence as the prep shade and the ceramic itself. So we need to make sure that you give us the prep shade. Again, if you give us the prep shade, then we know what translucent ingot or ceramic we need to use to give you the final shade that you want for that case. The next is the shade guide used. Again, there's lots of different shade guides. So we want to make sure that we have that shade guide. Now, we do, I know that for a fact, but we want to make sure that we're on the same page. If you order a certain shade guide, whether it be a Nortaki, whether it be a Chromoscope, whether it be a Vita 3D Master, again, we want to see that shade. We want to have it there as we're designing the case. The next is the shade of the incisal. And the shade of the incisal is basically the translucency. You know, we look at natural teeth and there's amber, there's a little bit of white sometimes, there's clear, there's smoky gray, sometimes there's a little bit of blue. And so we want to communicate. If I'm doing a cosmetic case where I have total license to change that incisal edge translucency, total influence on that, I want to make sure, one is I want to discuss it with my patient. I want to show them a photo, make sure they approve of that, and then I want to transfer that to the ceramist. So, you know, things we did here with the shade of the incisal, we have white, blue, gray, amber, clear. I actually like a frosted clear with a little bit of white in there. But again, if I'm working with the ceramist for the first time, if I showed that photo to the patient and the patient says, wow, that's awesome, I like that, I want to make sure that that is transferred accurately to the ceramist. And ceramists are very visual, they're artists. So if we can send that photo and we just email a photo, can you match this? And a ceramist can match something they can see visually. I mean, that's their artistic skill and mastery. So we want to make sure we transfer that. The next is surface texture. You know, some of my patients want no surface texture. Some of my patients want a lot of surface texture, so it looks natural. And then we have those that want something in between, a moderate amount. How do we transfer that? Well, photos. Denture teeth are excellent for our patients. I can show them a denture tooth and bring the operatory light and shine it down the denture tooth and say, you know, notice how the light, you know, you see some anatomy or texture on this tooth. And it makes it look natural. Even though going with a very, very bright shade, it looks natural because of the surface texture. And the patient may say, I don't like that. It looks rough to me. Okay, well, let's go to the less surface texture. What do you think about this? Then I can match that with either a photo again or send that denture tooth to the lab. So instead of it just kind of being subjective, where I think this is heavy and the ceramist thinks this is heavy surface texture, you know, there's no room for error because they have that denture tooth there or they have a photo. Again, I want to transfer that variable. The next is surface finish. Now, this is really more important when we're matching a single tooth because we've all had situations where we put a crown in or a veneer in and everything looks great except it's just too shiny because the glaze of ceramic tends to be shinier than natural polished enamel. So I want to make sure I transfer that to the ceramist so that we get a restoration back that looks like the rest of the teeth. Or if we're doing a big case, a smile design, 6 to 10 units, I want to make sure it looks natural but yet aesthetic. My preference for multiple units is always a polished gloss. So what they do is they still glaze your restoration to fill in the microporosities. And then they polish it using Diashine, a diamond polishing paste, which still is very, very shiny, but it's enamel shiny, not porcelain glaze shiny. I just think that's a better look. So my recommendation is actually ask for that polished gloss because a lot of laboratories, they'll just stick glaze on it and they'll send it out. And one, it's not as wear compatible as if you polish it with diamond polishing paste, and it looks too shiny. The next one is the amount of incisal edge translucency. So we told them the color. How much translucency do we like? In my practice, I like personally a lot of incisal edge translucency. And some of my patients don't necessarily like as much as I do. So I may show them a photo. Notice this looks natural. We're going to go very bright on you because you want a bright smile. Let's cheat a little bit by having some cool surface texture, a lot of incisal edge translucency. So people look at your smile and say, man, it's perfect, but there's no way it can be fake because of those characteristics. And so I want to transfer that from my patient to my ceramist. So I'll show my patient photos. I may show them a case that I like with a lot of incisal edge translucency, and they look at it and say, I don't like all that grayness. Okay, let me show you another one. Let me show you another one. Until they say, oh, well, I like that. It looks like a tooth, and I like the way it looks. I can just send that photo, either text or email, or I can actually print a photo, send that to the ceramist. So the ceramist looks at that and say, oh, that's easy to match, versus, again, being arbitrary or subjective with light, medium, moderate, heavy. I mean, those are, again, very subjective terms. The next is outline shape. And that's basically, what do we want this case to look like? Do we want it to be more feminine, maybe rounder corners? Do we want more open embrasures? And again, that's communication we're going to have with our patient, looking at photos, and also the provisionals. Again, the provisionals are a working diagnostic, functional, and aesthetic guide. So after we prep teeth and we go ahead and put them in provisionals, we see them again in 3 to 5 days and say, what do you like about this? What don't you like? Do you wish they were more rounded or more squared, or are they too long, too short, are they too fat, or whatever it is. We can alter that in the provisionals, then take an impression of that and a photo, send it to the ceramist so that they know basically what we want this case to look like. And then lastly is the length of the centrals. You know, the entire smile design is driven by the incisal edge position of the central incisors. I mean, you think about the mesial buccal cusp of the first molar. The position in space is driven by the buccal cusp tip of the second premolar, which is driven by the buccal cusp of the first premolar, which is driven by the canine. The canine cusp tip position is driven by the central incisor. So every tooth, we're following that smile line. So we got to make sure that we give that length. Otherwise, it's just arbitrary, especially if you don't really take time with your provisionals. If they weren't designed off of wax up, that you actually design the smile, then it becomes arbitrary. And if the ceramist screws up, and I say that, but it's really you screwing up as a clinician. Let's just call it poor communication. If we don't have that in an ideal position, then as we design this smile, it's not going to be exactly in the best interest of our patient. So hopefully that clears some things up, because I've had doctors call and say, why did they include this? Or why did they include this? Or how do you transfer this information? Again, photos, the most powerful. I think our patient develops what I call a brain smile. As I talk to my patient about shade, and they want it very white but look natural, and I show them some shade guides, I think they pick a shade and they put it in their brain. I've got to make sure that's the same shade I give to my ceramist. When I talk about surface texture, incisal edge translucency, shape, they're building this brain smile. I want to make sure their brain smile is the smile that my ceramist is going to design. So hopefully that clears up some clarification. Again, I can't stress enough how important the communication aspect is with your ceramist, as well as that relationship where you can get advice from them. I mean, every single one of my lab slips, and I've done thousands of cases, but every single one says, if you have any questions or concerns, or there's anything that I could have done to make this a better case, call me, because I want their input. They're artists. They're incredible people, and you can learn a lot from them. Hope that helps.